Does this make sense to you? Scenario fitting by Sceptikat. Part 9. Why so callous about lives lost if they didn't die of with Covid? Action if acting in the interest of the population. Track lockdown-related deaths. Forecast deaths caused by the lockdown also. Identify not just those vulnerable to Covid, but also those vulnerable to lockdown. Track non-Covid excess deaths as they occur and modify policy accordingly. UK government action, ignore lockdown-related deaths. No consideration given even to lockdown-related excess deaths, not modelled, not forecast, not tracked. We hear every day how many people died with Covid. Every supposed death is tracked and counted and repeated over and over. Yet another life lost to this killer disease, because every single life matters. Or does it? How is it that we never ever hear how many people have died because of the lockdown? There is no official tracking of those deaths, no curiosity about them, no concern expressed, just callous disregard, and yet the number of excess deaths caused by something other than Covid has been significant since March. The way Covid deaths are counted serves to inflate the number, see Part 8. Most of the reported deaths were with Covid, not of Covid, and a large number were merely suspected Covid, often suspected on the basis of very little. But even if we accept all these as genuine Covid deaths and rely on the official government statistics, ONS, we can still observe a large number of excess deaths since the lockdown started that cannot be attributed to Covid even by the government's very generous definition, and thus they are excess deaths that have been caused by the lockdown. The number of excess deaths may in reality be much larger if we consider that there is significant evidence that the virus has been around at least since the last quarter of 2019, but probably since the first quarter of 2019. The discovery of the virus in material, wastewater, etc., that dated from 3 to 12 months before the new coronavirus started spreading, raises the strong possibility that the virus is fairly harmless, as it had caused no excess deaths until the lockdown started, and that a large portion of the excess deaths were directly caused by the lockdown. What makes the lockdown deaths especially tragic is that the lockdown probably didn't save a single life, as the infection rate peaked prior to lockdown. The lockdown deaths were not the price to save lives from Covid, but were simply unnecessary, self-inflicted, avoidable loss of life. Increased mortality from illnesses is due to the cessation of certain medical services to the public during the lockdown, discouraging the public from seeing a doctor or going to hospital, and fear of the virus on the part of people who are already ill. That the lockdown causes a lot of deaths has been known and documented. The first flag was raised by Cancer Research UK, showing that the suspension in treating and the delay in diagnosing cancers is leading to significant mortality. The individual stories are just as heartbreaking as the much publicised Covid-related tragedies, but these stories do not get much publicity. Patients with heart conditions report a similar callous lack of treatment. Aside from cancers and heart disease, other conditions are also showing increased mortality, for example, asthma and diabetes. Mortality from dementia and Alzheimer's almost doubled. Even in care homes where most of the Covid deaths have occurred, it appears that some of the fatalities were due to the lockdown and not the virus. Scientists have suggested that the confinement of quarantine and overstretched care staff may have had a more disastrous impact than Covid-19. A further cause of lockdown deaths is that health is well known to decline under emotional stress, and isolation causes tremendous stress. Isolation is generally considered a greater health risk than smoking. On top of this come the mental health related casualties resulting from abuse and addictions, alcohol, drugs, and the increase in self-harm and suicides, deaths of despair. It is also important to remember that even though the excess deaths caused by the lockdown have already been significant in number, most of them will occur with a time lag. While deaths from the virus occur within a couple of weeks, a spike in mortality from lockdown-related causes will occur mostly with a delay, sometimes, such as in the case of undiagnosed cancers or alcoholism drug addiction, with a delay of several years. And the final kicker is that an impoverished economy will not be able to support pre-COVID standards of healthcare. A flood of COVID cases didn't break the NHS, but the consequences of the lockdown might. The silver lining. One very interesting fact is that while total deaths have been running 22% above the 5-year average to 19th June using ONS data, child mortality has fallen by 8%. For children under 1 year old and by 14.4% for children between 1 and 14. Although a possible reduction in the number of accidents for children over 1 may explain some of this, the reduced mortality for children under the age of 1 is unexplained. One major change during the lockdown has been that has also caused a delay reduction in child vaccinations. Is a drop in vaccinating babies saving the lives of babies? Why so little attention paid to these deaths? It is inexplicable and unforgivable that the government pays no regard to the already large number of deaths caused by the lockdown. This is the best we got, quoting the British Medical Journal. For the moment, it seems impossible properly to answer concerns about wider effect current measures might be having on the health of the population. The data are incomplete, too uncertain, and too fast-moving to support any reliable conclusions. Shouldn't there also be regular headlines such as Coronavirus, 917 new lockdown-related deaths as UK told to stay at home? Why is a life lost only worthy of mention if the cause was, supposedly, the coronavirus? In summary, there have been a significant number of excess deaths not due to COVID already during the lockdown from multiple sources, with many more to come. The government appears to pay no attention to the large number of non-COVID excess deaths clearly caused by the lockdown. No consideration appears to be given even to the immediate cost in lives due to the lockdown, never mind the ones that are likely to occur with a lag. Sceptikat says this makes no sense. Join us for part 10, Forgot to Factor in the Cost of the Lockdown. Thank you for watching. You can reach me, Kat, Sceptikat, at sceptikat@peerlessreads.com, Andrew and Kat see it, or privately at kat@sceptikat.com.